Hi, it's Dr. Windisch once again. Welcome to Sparks Pediatric and Adolescent Medicine and our video library of information for you. Our office number is 359-7111, area code 775, and we're available for consultation to see your child if you're concerned. Remember, these videos do not replace meeting with your physician. Today we're going to talk about urinary tract infection in children, and the first message I want to relay to parents is this is not mom's bladder infection. Urinary tract infections in children by definition are complicated and by definition are very concerning. And so we need to be very aggressive in both the diagnosis and the management and the evaluation of this disorder if it happens to your child. So the first thing is, how do we diagnose a urinary tract infection? Children are too young, many children are too young to urinate into a cup. If we're going to obtain a cup sample, they need to be able to urinate directly into the cup, not into another container. They need to be able to do that in a midstream. So they need to be able to start passing urine and then collect the middle of the urine stream. That's very difficult for young children. If we are concerned about urinary tract infection for these children, we then need to catheterize the children, putting a small tube in their bladder to obtain urine. If we're unsuccessful with that or unable to do that, our only other alternative is called a suprapubic bladder aspiration, where we can put a small needle into their bladder through the skin. This is not something we need to do a whole lot, but once in a while it is still necessary to do. Most importantly, one cannot collect this urine in a bag that's attached to the genitalia of the private. That bag, no matter how well you scrub the skin, is always contaminated, and that sample is meaningless. So if you're concerned that your child has a urinary tract infection, don't allow your physician or the emergency room to place a bag on the child's genitalia to collect the urine. It's an inappropriate sample and a meaningless sample. That urine then needs to be evaluated for urinalysis, but more importantly, in children, all urines, when evaluated for urinary tract infection, must be sent to the laboratory for culture. About 1 out of 10 children will have urinary tract infection without any findings on their urinary dipstick or the microscopy. And so if you don't culture this, you will miss those children. Do not allow the hospital or your physician to diagnose you with a urinary tract infection without sending the urine to the lab for culture. This is critical in all children of all ages. If your child has a urinary tract infection, they need to be treated aggressively with antibiotics. If they're not able to tolerate stuff by mouth, they may need injectable or even intravenous antibiotics. Once that is treated, most physicians prefer to get a test of cure to make sure that the infection has in fact cleared up. If your child has a culture-proven urinary tract infection, additional evaluation may be necessary. It's becoming questionable whether we need to ultrasound the kidneys or not. There's a lot of controversy on this one. Many physicians still prefer to ultrasound the kidneys, and that's okay. But if your child is male, or if your child is definitely under 2 years of age, and some physicians will say as much as under 5 years of age, the bladder needs to be pressure tested. This is a test called a Voiding cystourethrogram. And to do this, we will take the child, we send them to the radiologic suite. The radiologist puts another small catheter in their bladder and they fill the bladder with dye. The key for this is to then, or the reason we do this is to then look and see if urine passes backward from the bladder into the kidneys. The tube from the kidney to the bladder is called the ureter, and that should be a one-way street and only run from kidney to bladder. But if we see urine go back into the bladder, or back from the bladder into the kidney, that's a bad thing, and that's a very serious issue. If your child has that, it's called vesicoureteral reflux and needs to be monitored very closely and potentially treated with surgery or regular daily antibiotics. This is a very serious situation. Undiagnosed, untreated vesicoureteral reflux is the #1 reason for kidney failure in the world. In the United States, it's not a very common problem because we're aggressive in obtaining voiding cystourethograms and in managing those children with antibiotics and or surgery. If you think your child has vesicoureteral reflux, if he or she has been diagnosed with that, you need to make sure you follow with your physician to demonstrate without a doubt that that has resolved. If you think your child has had a kidney infection, if your child has been diagnosed with a kidney infection, please see your pediatrician and let them know. This needs to be evaluated very closely. We don't want to see children requiring something like renal transplant or dialysis as a result of this, because it is preventable. If you think your child has had a kidney infection or has a kidney infection, please call our office. We'll be happy to see you. Area code 775-359-7111. Thank you.